Now we're going to move on to muscles that move the forearm and the hand, flexors and extensors of the wrist joint. The muscles that flex or extend the wrist joint or originate on the humerus and ulna. They insert on the carpal and metacarpal bones, on connective tissue structures, the flexor retinaculum and palmar aponeurosis. They are either found on the anterior forearm, that's the flexor group, or on the posterior forearm, that's the extensor group. And here's our list of the 5 or 6 muscles, depending on how you count them. There are 3 flexors, the flexor carpi radialis, the palmaris longus, and the flexor carpi ulnaris. There are 2 or 3 extensors. If you put the extensor carpi radialis longus and brevis in one group and count it as one, that's okay. And then there's the extensor carpi ulnaris. Only the tendons of the wrist muscles cross the wrist joints. The tendons cross the anterior and posterior surfaces of the wrist through synovial tendon sheaths that reduce friction. And that makes sense because we're constantly using our hands and we're constantly using our wrist flexors and extensors when we use our hands. And you can imagine that there would be a lot of friction on the tendons of these flexors and extensors of the wrist joint. Now, the tendon sheaths are held in place by an anterior band of connective tissue that's called the flexor retinaculum. Flexor standing for the fact that it's holding down the flexors of the wrist joint. And retinaculum you can think of as a word for connective tissue band. So the flexor connective tissue band anteriorly, and the extensor retinaculum, the extensor standing for the fact that it's holding down the tendons of the extensor group of muscles, and then the retinaculum standing for connective tissue band. So in this slide here, we see the flexor retinaculum is a wide band of connective tissue shown here in this anterior view. And then the extensor retinaculum is seen in this little picture showing the posterior view. They just look like straps of connective tissue that go across the wrist joint. And then the palmar aponeurosis is a thick triangle of connective tissue with the point by the wrist joint and the base of the triangle by the base of the fingers. The palmar aponeurosis is actually superficial to the flexor retinaculum. And the job of the palmar aponeurosis is to protect the tendons, the blood vessels, and nerves in the palm, which, think of all of the wear and tear on your palms every day as you go about your business, holding things, driving, using your hands for all of the things that we use our hands for. Okay, so now let's start our discussion of the 3 flexors. The flexor carpi radialis. The origin is the humerus, the medial epicondyle. The insertion is the metacarpals 2 and 3. The action is flexion and abduction of the wrist joint. And if you look at the origin and the insertion, you can see that it makes kind of a big strap that crosses the anterior forearm from the medial humerus to the lateral wrist. And you can understand how it would cause flexion of the wrist. And then to understand how it causes abduction, think for a minute that your hand is in an anatomical position, and abduction means being taken away from the midline. So we're talking about moving the wrist joint in such a way that your thumb moves more laterally away from the body. Okay, now the palmaris longus, the origin is on the humerus, the medial epicondyle. The insertion is on the flexor retinaculum and palmar aponeurosis. The action is flexion of the wrist joint. This muscle travels from the medial humerus to the center of the wrist. Now the flexor carpi ulnaris, the origin is the humerus, the medial epicondyle, and the ulna, the olecranon. The insertion is the carpal bones and metacarpal 5. The action is flexion and adduction of the wrist joint. This muscle travels from the medial humerus to the medial wrist. And if you remember that adduction is bringing something closer to the midline of the body, you can imagine taking the wrist joint and just sort of, I'm going to put up my hand. I don't know if you can see it. Just, taking it and moving the pinky closer to the midline of the body. It's hard for me to show you my hand in anatomical position in the little tiny picture of me. So I won't try. I'll do it in class maybe. So those are our 3 flexors. And now the extensors. The extensor carpi radialis has a long muscle and a short muscle. They're actually separate, but you can group them together. The origin is the humerus, the lateral humerus. The insertion of the longus is metacarpal 2, and the insertion of the brevis is the metacarpal 3. The action is extension and abduction of the wrist joint. The extensor carpi radialis longus is superficial to the extensor carpi radialis brevis. They travel from the lateral humerus to the lateral wrist. So remember, we're on the posterior of the arm now. And both of these pictures are a posterior view of the right arm. And if you look at their origin and their insertion, you can imagine that they can cause abduction of the wrist joint or drawing of the pinky towards the midline because we're in the back of the arm. Looking at the pictures, the posterior view of the right arm and the origin and insertion of the muscle, you can imagine that contraction of the muscle is going to cause abduction of the wrist joint or moving of the thumb away from the midline of the body. So abduction, moving away from the midline of the body. Okay, the extensor carpi ulnaris, the origin is on the lateral humerus and the posterior ulna. The insertion is on metacarpal 5. The action is extension and adduction of the wrist joint. This muscle crosses the posterior forearm from the lateral humerus to the medial wrist. This is a posterior view of the right arm, and you can imagine that contraction of this muscle causes adduction of the wrist joint, drawing the pinky closer to the midline of the body. And remember, if you held your hand straight up and then just tipped the hand from side to side, like a royal wave, you're talking about abduction and adduction of the wrist joint. Now, here's a table for your learning, and here's a clinical correlation. The flexor retinaculum and the tendons of the flexor muscles that run deep to it sometimes get inflamed and swell. The median nerve that passes under the flexor retinaculum may then be compressed, and the blood supply to the nerve may be compromised. And this injury to the median nerve causes carpal tunnel syndrome. Carpal tunnel syndrome is a common injury to the median nerve, and it is associated with pain, numbness, tingling, and weakness of the metacarpals 1 through 4. The syndrome is treated with rest and sometimes even by cutting the flexor retinaculum. And you can look at the picture and you can appreciate by looking at the picture, they're showing you in the little cross section that there are all of these tendons running through the carpal tunnel, and there's the flexor retinaculum on the anterior of the wrist joint, holding everything down. And then in yellow, there's the median nerve. And then we'll do nerves later, but understanding the median nerve, the fact that it innervates the first 4 fingers, actually the first 3, the thumb, the pointer finger, the middle finger, and the ring finger, but only half of the ring finger is actually innervated by the median nerve. So that's why they're only showing half of the ring finger in purple. So you can look at those pictures. All right, so moving on to muscles that move the hands and fingers. So we've gotten out of the muscles that move the forearm and the hand. That was a lot of work, but we did it. And now we're going to look at muscles that move the hand and the fingers. From the extrinsic group, we're only going to look at 2. So let's get us started. There are 9 extrinsic muscles of the hand. They originate on the humerus, radius, and ulna and insert on the wrist, hand, and finger bones. These muscles provide strength and gross motor control for movements of the hands and fingers. They flex, extend, abduct, and adduct the finger joints and are found in 3 layers. The flexors are found on the anterior forearm and the extensors are found on the posterior forearm. We're going to study 2 muscles from the middle layers, one from the anterior layer and one from the posterior layer. From looking at the anterior picture, we're going to look at just one muscle from the middle layer, the flexor digitorum superficialis. And then looking at the next picture, which is a posterior view, we're going to look at one muscle from the middle layer called the extensor digitorum. So we're getting towards the end, folks. And these are the last 2 muscles that you're responsible for. So the flexor digitorum superficialis, remember, we flex the elbow anteriorly, we flex the wrist joint anteriorly, and we flex the fingers anteriorly. So the flexor digitorum superficialis, the origin is on the humerus, the medial epicondyle, the radius, and the ulna. The insertion is on the phalanges 2, 3, 4, and 5, on the anterior phalanges. Action is flexion of the wrist, the metacarpophalangeal joints, and the proximal interphalangeal joints. I know that's a mouthful and you have to kind of break it down. Metacarpophalangeal means that these are the joints between the metacarpals and the phalanges, which are the fingers. And then interphalangeal means between the phalangeal joints. So remember, we have 2 to 3 little phalanges in each of our digits. So these are the joints that are between the 2 to 3 little bones, 2 in the thumb, 3 in each of the other fingers. These are the joints between those little bones, the phalanges. The flexor digitorum superficialis is deep to the flexor carpi radialis, palmaris longus, and flexor carpi ulnaris that we learned in the last section about muscles that act on the wrist joint. Our last muscle that you're responsible for, the extensor digitorum. This is an extensor. So remember, in the arms, we extend the glenohumeral joint, the elbow joint, the wrist joint, all posteriorly. And these muscles are found on the posterior of the bones, and this is no exception. So the extensor digitorum is found on the posterior of the right forearm. The origin is on the lateral humerus. The insertions are on the phalanges 2, 3, 4, and 5. These are the posterior phalanges, of course. The action is extension of the wrist joint and the phalanges joints. The extensor digitorum is between the extensor carpi radialis, longus and brevis, and the extensor carpi ulnaris. Here's our table. I circled in red the extensor digitorum and the flexor digitorum superficialis. And all of these other muscles are ones that you are not responsible for learning. And finally, FYI, I would just like to say muscles that move the hands and fingers are not actually done. There's a whole intrinsic group. There are 11 intrinsic muscles of the hand that originate on the carpal and metacarpal bones. They flex, extend, abduct, and adduct the carpo-metacarpal, metacarpophalangeal, and interphalangeal joints. They control fine movements of the hands and fingers. And here's a list of them. You're not responsible. This is FYI. I just wanted you to know that the hands are complex. Okay. Stop share. End meeting. See you soon.